Hello, welcome back. I'm really excited today to bring you a video about gout. And if you're a patient of mine, then you probably know that one of my passions is treating gout. And I have a dream that I can essentially put all gout patients in the Phoenix, Arizona area into remission. And I know that's a lofty goal, and you may think that I am totally crazy, but I think I can do it. I love treating that condition, and most of all, I really want to get the word out there that gout is treatable. Gout is something that you do not have to suffer with. You don't have to struggle day in, day out, week after week, month after month, year after year with gout flares, because we have medication that works very, very well to treat gout. The caveat, however, is that most of us, when we learn about treating gout, for example, we learn to treat it as these episodes occur, meaning you have swelling in your toe or your ankle or a joint that is related to gout. We give you medication like an anti-inflammatory, maybe some steroids, maybe colchicine, and recommend that you take it until the pain goes away, and then you're done. However, our understanding of gout or hyperuricemia, uric acid buildup in our bodies, has changed dramatically over the last decade, even to the point now that we can associate gout with increased risk of high blood pressure, hypertension, increased risk of developing type 2 diabetes, increased risk of kidney damage or renal dysfunction, and a whole slew of other things like atrial fibrillation, potentially. Arthritis is a big one that we underestimate the effect of. Tendinitis. Gout can really reach anywhere in our body, but does not cross the blood-brain barrier that we know of, meaning gout does not get to our brain, but we can have uric acid build up anywhere else. I have a patient right now that I'm treating who has tophi, or uric acid deposition, build up along his Achilles tendons. So his tendons are very bumpy and painful, in addition to the gout associated with his joints. One of the common signs of gout, aside from the big toe swelling that we call podagra, is bursitis. So you can actually get a big lump or clump of uric acid, tophi, build up along your elbow, and you can actually feel it in there. It feels kind of pebbly or lumpy and bumpy in that elbow sac of fluid that builds up. So the reason that I'm so passionate about gout is because, like I mentioned, a lot of times we just treat it episodically, but I want to treat it to cure it. To treat it, to put it into remission is the language that we use in rheumatology, meaning we can control your symptoms with medication, the right dose of medication. And that is the most important thing that I want you to take away from this video. If you are a patient or know somebody who struggles with gout, have them see a rheumatologist, because the uric acid level that we can draw from a blood draw is how we monitor if your medication is at the right dose. And particularly, I'm talking about allopurinol or Uloric, which is also called febuxostat. And then there's Krystexxa, which is an IV infusion that we monitor your uric acid level every 2 weeks for. But if you're on one of the pills, it is very, very important to know what that uric acid level is, because that's how we measure the effectiveness of your treatment. If you're given a pill, a dose, like 100 or 300 milligrams of allopurinol, or 40 or 80 milligrams of Uloric, and never had your uric acid monitored ever again, that's like giving somebody an arbitrary dose of a blood pressure medicine and never checking to make sure that it's working. These medications only work if we dose them at the appropriate dose for your specific uric acid level. And the current recommendations or guidelines set forth by the American College of Rheumatology are to target a uric acid goal of less than 6 for somebody who's had 2 or more gout flares a year, less than 5 if you have tophi, meaning those deposits that we can see and feel, or joint damage caused by gout called erosions. However, there are studies and multiple publications out there that may show and talk about that number less than 5 may need to be even closer to 4 or 3 for some people to really get rid of their flares and attacks. So the big message that I want to get across today is that gout is treatable. There's a lot of shame associated with gout because we think that it's something we're doing to ourselves. We think that it's something that we're doing by the way that we eat, meaning red meat or shellfish or drinking alcohol. And so a lot of people approach treating gout very commonly by asking patients, what did you do to cause this? What did you eat? And telling them to change their diet. And yes, that can be true, but there are plenty of people out there who don't eat red meat, who don't drink alcohol, who still really struggle with gout, and it's not your fault. It's actually a component of genetics, which we have zero control over, and our kidney function. If our kidneys are not able to get rid of uric acid effectively, meaning filter it out, then it builds up in our body. And once it builds up to a concentration that's high enough to start to deposit, it's like rock candy. We start off with these little granules of uric acid that then cluster and explode into this huge, massive crystallization explosion of pain and swelling and redness and shame, right? So we can help you with that. Rheumatologists can help with that. And if you're in the Phoenix, Arizona, I would love to be the person that helps you treat your gout because I have a way of really targeting the goals that you have and the approach of decreasing that uric acid so that we get gout to go away. And if you want to make an appointment, schedule an appointment with me, you can find me online and come meet with me and talk about ways that we can treat your gout and eventually get the flares to stop. There's lots of other tips and tricks that I have related to gout and treatment and manipulation of your medication that I'm more than happy to spend time to talk about. And then also have a backup plan for as you're going through treatment, how can we help you through the flares? Because they are inevitable in the beginning, but eventually they'll stop with the right combination of medication. And it's nice to just know that somebody's on your side. I want to be that somebody to help you through this because just like how there is a lot of awareness about rheumatoid arthritis and lupus and psoriatic arthritis, I want to build more awareness about gout. So one place that's very helpful to start is a website called goutrevealed.com. And that website is great at explaining all of the other reasons that we want to treat gout. It talks about blood pressure, kidney function. There's some great pictures of how gout can deposit in the body and ways that we're studying to identify these uric acid deposits and how it affects other things like chronic back pain, like, again, joint pain and arthritis, and overall well-being, right? If you have a condition that you're suffering with and are nervous about getting an attack, you're nervous about going on vacation because you know that the minute you leave, you're gonna have a flare and it's gonna ruin your whole trip, we can help with that. We can help so that that doesn't happen year after year after year. So hopefully this video is helpful for you or someone that you know. Feel free to share and spread the word. And again, come find me if you're in Phoenix. I want to be your gout doctor. Thank you so much. We'll see you around. Bye-bye.